everyone. This will be a webinar just covering the 3 ways to optimize the way you find and hire top talent. It should be around 20 to 30 minutes. But throughout this, please feel free to put any sort of questions in the chat, and we'll ensure that we address them either throughout the webinar or at the very end. Just to make introductions before we get started, I have with me Dr. Beth Brooks. Beth has been a clinical advisor to Vivian for the last 2 years. Prior to that, and really throughout her entire career, she's held a number of different roles throughout nursing, recruitment, and retention. And myself, Adam Binford, I've been with Vivian for about 2.5 years now. I support our clients that are health systems and providers throughout the country. Really key learning objectives for today. We'll cover 3 different things. The first is to really review the job seeker survey findings. So this is the candidate survey that we send out to candidates within our platform every single year. The second is to really underscore and describe the challenges facing talent teams today, both from the perspective of candidates, recruiters, and hiring managers. And the last is really to explore how machine learning can help augment and support, at least on the front end, a lot of recruitment efforts and how we use machine learning at Vivian Health here. But before we actually jump into some of the pain points and review the findings, I did just want to level set quickly on Vivian Health for anyone that's not familiar. Vivian Health is the largest healthcare-only talent marketplace in the country. 1 in 4 nurses actually use and are on Vivian looking for their next position. We are also the fastest growing healthcare marketplace. We had around 80,000 clinicians across nursing and allied health sign up last month on our platform. And lastly, Vivian Health is not like a stale resume database where candidates just sign up for. It really is an active talent marketplace where clinicians are looking for their next role. So on average, we do about 110,000 applications monthly. So we'll dive in next in terms of the experiences across recruiters, candidates, and hiring managers, and some of the pain points in the process. And at this point, we'll start with recruiters, and I'll turn it over to Beth.
Hi, everyone. Welcome, and thanks for joining us. I almost said this morning or evening or morning, whatever it is in your time zone. We want to talk a little bit today about some findings that we had last year from a qualitative study, a small qualitative study we did in the summer of 2022. And as a result of this study, we learned a few things. And from our recruiters' perspective, this is a flow of how candidates move through the process. And we know that right now it's really challenging for recruiters. There's 3 major things going on in the marketplace. There's this complexity of an urgency for jobs, right? We have significant urgency to fill some of these vacant positions, in particular in nursing. And we know it takes about 60 to anywhere to 120, 112 days to recruit a nurse. And then there are so many openings, and it becomes difficult to understand what exactly are the positions that are open and how well your position control process is at your organization. Sometimes there's more open recs than there are positions. Sometimes there's duplicates. And so it's just really hard sometimes to get a sense of exactly how many positions are open, and then just to stay on top of vacancy rates. We also know that talent teams are under a lot of financial pressure. Certainly the last couple of years have been really challenging with COVID, and most talent teams and departments are looking to decrease their expenses, and in particular around premium labor. And also a lot of organizations are thinking about reorganizing how they organize their talent function. And in one of the studies I read in preparation for today, we had one organization that had 1.2 FTEs with 39 managers. So 1.2 people managing relationships and recruitment for 39 managers. And that's only direct care and ancillary, but that's a pretty significant workload. And we'll talk about that a little bit later. And then the other thing that's going on in the marketplace, in addition to financial constraints and this urgency, is this evolving candidate landscape. We don't always know what's going on in the market, which nurses are working full-time, part-time, leaving the bedside. We know we lost 100,000 35 and 40 years and younger RNs during COVID, which was for all those reasons that we're aware of. And then we also know enrollment went down last year in our BSN programs. So things are a lot different in the marketplace than they've been in the past. So in this next slide, we like to talk about having recruiters practice at the top of their license, much like we say that about professionals, right? Nurses, LPN, physician, are they all doing the activities that require their level of licensure? Same situation is happening for our recruiters. A lot of times the recruiters are in low value activities. They are managing paperwork, trying to source candidates, and there are some opportunities now with AI to really improve the entire process. And there was a paper that came out just in 2019, and it listed all the places that AI is now being used in recruitment and selection. So from posting job vacancies to optimizing job descriptions, targeting ads, sourcing candidates from multiple databases, screening resumes, powering psychometric testing, conducting video interviews, especially the screening, doing background checks, and then chatbots and things to engage candidates. So this automation is going to provide tremendous opportunity for the talent teams, primarily because it will allow more time to build those relationships that are so important with both the candidates and the hiring managers. And there'll always be a need for recruiters because we'll always need that human touch in this recruitment process. So now I want to talk a little bit about what's going on with the candidates. And there's a research study almost 20 years ago now talking about the problem is the process in nurse recruitment. And interestingly or not, a lot of those results or findings were the same. Unanswered phone calls, voicemails full, being on hold too long, not knowing where the HR, or you go into the hospital and you go to the information desk and they don't know where the HR department is. So there's all these different kinds of experiences that candidates are having with recruiters, and they can either be very transactional and the candidate doesn't really feel engaged in the process. There are times when recruiters maybe are too busy, aren't focused, aren't able to listen as well as they might like. And so the candidates feel like the recruiter's not really that interested in them. And then we have the candidate experience where the candidates are really able to connect with the recruiter. They find that recruiters are more personable, more attentive, have been listening, make eye contact, can answer questions, are positive, are friendly. So all of those attributes that the recruiter signals to the candidate make a difference in whether or not the candidate accepts the position, because it's called signaling theory. Those signals that recruiter sends influences that candidate's decision, and the candidate in their mind is thinking, everyone in the organization is this way. So it's an important opportunity, if you can, to be very candidate centric in your recruitment, and which takes more time, which we hope the technology, and we're going to talk about that, Adam, will provide you with some of that extra time that you can connect with the hiring manager, but also connect with the recruiter. And so here on this next slide, you'll see all the different steps that the job seekers are going through. And they have needs, right? They want to know what are the steps in the recruitment process. They want to know how long the process takes. They want to be apprised of where they are at in the process. Culture has become a very more, even in some instances, more important than salary. So how much you can share your culture as you're taking a candidate through the interview process, all of those things matter and can begin to build that relationship with the recruiter and the candidate, so that the candidate feels like they're welcomed into this process and not just another pretty face, so to speak. So once we've seen this process for our candidates, now let's look at what's going on with our managers. And this is where the hiring managers provided some feedback and said things like, I'm receiving candidates that aren't qualified. I'm receiving candidates that haven't really been screened. This candidate doesn't even really fit on the opportunity that's on my unit. Just last year, the American Organization for Nursing Leadership conducted two parts. They did a major study. 2,300 nurse manager leader types and recruiters talked about how to improve the recruitment and hiring process. And then from those research findings, they convened work groups, and there were 7 work groups. and all different experts from all different settings in healthcare talking about how do we streamline this process. And one of the results from this work was a goal to have a 7-day hiring process. And so sounds ambitious, very aspirational perhaps, but we all know that the longer the process takes, there's risk that you might lose a really talented candidate because another organization is able to move candidates through the system. And there's actually, and we'll share with you a reference list at the end of the session today. There's a couple of studies that have just come out where teams are talking about how they have reworked their entire recruitment process. And it's something that requires lots of different types of people. It's not just HR, it's hiring managers, it's senior leaders working really hard to smooth out that process, because we know it's just, if it's too long, there's just an opportunity to lose really talented candidates. And on this next slide, talk a little bit about, again, what are the things that could support managers? And I know sometimes they're too busy. They're too busy to schedule an interview. They're too busy to talk to a candidate. I'm well aware of those challenges. That's why it's so important to have high level project team work, and starting at that C-suite level to start to work with teams to rework the entire flow. So quality of candidates is important, better matching and better screening. There's recommendations in the work report about job postings. Don't need to tell a nurse what a nurse does. What you might want to say is what's different about this opportunity or this role. Also, with the manager and having more time to get to know the recruiter, and the recruiter knows the manager, and then they know the candidate. That allows both the recruiter and the manager to assess this candidate for how well they're going to fit in the organization, but then how well would they also fit on that unit. So you can't really make those assessments unless you've had more quality time, if you will, with that candidate to better understand whether or not they'll be a good fit. Managers would like some visibility into the ATS, want to know where someone is in the process. And likewise, they want to track those candidates. And what two different organizations have done is begun having a monthly meeting at the C-suite level about candidates and pipeline, but then every 2 weeks at the hiring manager level, having a conversation every 2 weeks with the talent team to reassess where candidates are in the process so that everyone's on the same page. So there's lots of recommendations in that report. And one other thing I want to share with you in this next slide, Press Ganey, who I'm sure all of you are familiar with Press Ganey and their work around both staff engagement and patient satisfaction. Back in 2022, they collected data from 123,000 nurses, right? So all the nurses that are in Press Ganey's, not all, but a significant number of the nurses who are in Press Ganey's database. And this is what they have, Press Ganey's recommending around the manager and candidate interviewing process, because it's pretty clear that when there's more time spent, there's a better outcome and reduced turnover later. And I'm sure during the pandemic, many of us probably got away from more lengthy interviews because of COVID and the need to fill roles quickly. And there was just this urgency. Now it's probably time to take a step back and say, let's look at this piece of the process. And so Press Ganey talks about 45 minutes with the recruiter, 45 minutes with the hiring manager, and then 30 minutes with a peer interview, and then some type of an activity where that candidate can be immersed on the unit. So maybe they put on scrubs and are shadowing a nurse, or maybe they attend a quality or a patient safety meeting or shared governance, some kind of opportunity for that candidate to really get a better sense of the organization. And I know it's probably sounds, oh gosh, we can hardly get a 30-minute interview with the manager, but it is time well spent because it does decrease that turnover and that revolving door So something, and the reason I like the immersion activity, in many respects, it's like a realistic job preview, so that candidate is going to have a much better sense of what the work in the unit's really like. So if we take all those three journeys, we had the recruiter, we have the candidate, and we have the manager. This is why everyone is so miserable. There's just this crazy disconnect, and folks going on three different pathways and not necessarily always being on the same page. And then this is multiplied by however many candidates you're trying to woo, if you will, in the process. So we want to share with you this 7-day hiring process recommendation from the American Organization of Nurse Leaders. And again, realize it's very aspirational, very perhaps too idealistic, but nonetheless, I think there's some ideas here to work toward a more smooth and seamless process. And so, as you can see here, it's 7 days. So things are just accelerated. Drug panel can happen earlier, licensure, background checks, certification checks, all that can happen earlier in the process because theoretically, and Adam will show you this, those candidates that are coming to the door are going to be much closer and ready to move through the process than some of that sourcing time that takes days. And so we'll show you that. And then the other thing that's interesting about AONL's recommendation is this idea of no nurse left behind. And this is where it's nice if the recruiter is assigned to a unit rather than to an open rec. If the recruiter knows that this candidate does not accept the job offer, then recruiter to recruiter, we can find other opportunities for that candidate within the organization so that we don't have to restart this process all over again. So again, the citation is there on the slide for you to take a look at that compendium of strategies. And we'll let Adam now talk a little bit about how Vivian's technology really helps expedite this process. So on to you, Adam.
Thanks, Beth. And thanks for highlighting the pain points and again, the AONL recommendation. So what we're proposing here, again, given that the recruitment process is a very human-centric model, AI, machine learning can't replace that, but what we can do is try to augment, at least on the front end of the process, hopefully driving more time back to your recruiter so that they can engage with qualified candidates and move them through the funnel a lot faster and get them in front of hiring managers. So the first recommendation is really reviewing the model. I think the previous model was more optimized for volume. What we're proposing now is more of a model optimized for hiring. And we do this based on what we call job alerts. And it really is taking 3 different data sets, the first of which is a candidate's stated intentions. So this is what a candidate has in their resume, their work history, background, also what type of roles are they interested in? Is it a permanent type of position? Is it a PRN, shift-based position? Is it a local contract? What sort of pay are they looking for, and location? In the Vivian platform, we do essentially obtain this information up front that creates a candidate's universal profile. So we have this to essentially work with. The second is really the observed intentions from these candidates. And that is going to be, what are candidates actually doing within a platform? How are they searching for roles? We do not want to push a job to a candidate if they're not looking for a role in their respective city, i.e. a candidate's based in Denver, they're looking for a job in, say, Chicago. We do not want to push roles to them in Denver, but that in Chicago, because that's really what they're actually interested in looking for. And the last is job-specific data sets. This, in our opinion, is a pretty underdeveloped part of this model. What we find is that a lot of how different health systems are posting positions, it's not very standardized. Some are posting X, some are posting Y, some more information versus others. When we do apply an employer's jobs onto the Vivian platform, we do standardize this, and we do also require a lot more information, such as pay, shift, location, etc. When we have all 3 of these data sets, what we can do then is actually take employer's position and push this to candidates based on their profile and their search activity, so that we're reaching candidates, or we're sending the right job to candidates at the right time, hopefully converting to more engaged conversations and hires. And the last part that we really use too, outside of the actual job alerts feature, which again, our hope is that this really does look to replace more blind proposals, which is going to be high volume, in our eyes, high effort, low yield, and replace this with job alerts that should hopefully take care of this for you. The second kind of manual task that we see takes up a lot of recruiters' time is declining unqualified candidates. A lot of recruiters and sourcers that are using larger marketplaces and platforms are engaging with a lot of candidates that may not actually be interested. They apply to the role, but maybe 1 in 10, 2 in 10 are actually interested. So any role that we have posted on the Vivian platform, as soon as a candidate actually applies to it, we do have a number of screening questions set up based on licensure, available start date, and the role type. This helps reduce about 80% of what we would call the noise, or candidates that are really not interested in that role. So it gives more time back to your recruiters to engage with, again, the qualified candidates and moving them through the funnel a lot faster versus just the repetitive task of unengaged candidates. The last two from what we hear is collecting documentation. So collecting resumes, licenses, certifications, references, all of this up front, again, takes a lot of time. Going back to the Vivian Universal Profile, when candidates sign up, they have all of this kind of in one place so that it's easily downloadable or can even be pushed directly into the ATS, which really does help on the front end. In terms of the automation and the AONL recommendation, that really is the end of the webinar. Please feel free to place any questions in the chat and we'll be sure to address them. If there's any questions, please feel free to email Beth or myself. I'm sure when we send out the webinar recording, we'll also have a way to get in touch with us. Where are you getting the candidates from? So I can take that question. Around 50% of candidates actually sign up on their own via word of mouth. We do have a very large presence within the nursing community and clinicians. So around half of them, it is pretty much word of mouth that are signing up. The other 50%, we're doing similar things, working with Google and SEO, some sort of paid marketing channels. We do work with influencers on TikTok and Instagram, et cetera, really driving the Vivian value prop of come to Vivian, see all clinical positions, have one complete profile that you can use to apply to different roles. And on top of that, use the mobile app to really chat with and engage with recruiters more efficiently. I think that's all the questions for today. So thanks for the time today.